Shannon, let's talk sealants with children. Should they have them on their first teeth, their baby teeth, on their second teeth? And for that much, is a sealant good, needed, necessary, sometimes or always, even for adults? What's the deal on sealants?
Okay, well, you asked a lot of questions there, so let me do them one at a time. Sealants, the most important tooth, in my opinion, and I think in the medical profession's opinion as well, is the first permanent molar. Now, what is the first permanent molar? Sometimes we call them the 6-year molars because they usually come in at age 6. Now, for anybody that has a 6-year-old, you know what I'm talking about. Now, no baby tooth falls out in order for that molar to come in. So that they sneak in, I like to call them that, they sneak in the back. And when they sneak in like that, parents don't know they're there. So when the child's brushing, and most children are not excited about brushing every aspect and every area of a tooth. And I can't understand why, because I'm sure their parents brush every tooth in their mouth exquisitely well and everything, but the average person doesn't like to get all the corners.
Are you being sarcastic, Doctor?
A little bit. So here's this.
Am I detecting some sarcasm here?
Well, the problem is, if you're not going to watch your 6-year-old brush their teeth, I guarantee you they're not going to brush their teeth very well. And that's when the habits of adulthood really start. So here's this 6-year-old that rather be playing in the mud, and now you're telling him to go wash up and brush their teeth, and I don't think they're going to do a great job. But anyway, because they come in further in the back, a lot of children are uncomfortable back there. They go to brush back there, and they actually will gag a little bit. They feel like there's something going down their throat. They're not used to going back that far. At that age. So they hesitate. These permanent teeth have very deep grooves in them, grooves that will certainly attract and hold on to pieces of potato chip, and will hold on to all kinds of goodies that your kids are eating, including healthy things. It doesn't have to be unhealthy, but as we talked about in another time, a lot of even the healthy things break down into basics, and those basics can wear on the teeth. So you've got these grooves down in there that are much deeper than the baby teeth in front of them. So it's hard to physically get that brush behind the flat tooth down into the groove of the other tooth. So there's difficulties with that. To resolve that issue, if a sealant is flowed into those grooves, blocking them from ever getting anything on them, then that tooth is never going to weaken. It's never going to get a hole in it, which eventually, obviously, the hole in the enamel is just another word for a cavity. It's never going to get a cavity, and it's never going to get the kind of cavity that's so far back there that you may not even notice it. And if for some reason the child doesn't come in every 6 months for a cleaning because maybe he was sick and, something happened where they just, kind of lost track of time, and it's now, let's say, 8 months before they realize, oh, my God, we need to go to the dentist. 8 months, if that cavity started 8 months earlier, it could be a very large hole in that tooth. So this gives the parent, in my opinion, number one, peace of mind that the teeth are healthy back there. And number two, it gives the child a chance to develop proper habits. Okay, so that's the first part of the question. The second part of your question, you said, what about putting it on baby teeth? That's a very individual situation, because as I just mentioned in my example, baby teeth a lot of times, not always, but a lot of times are very flat. They're certainly flatter than the permanent teeth are going to be when they grow in, and you may not need to have sealants on those. So that's kind of an individual basis. But if the baby tooth has enough of a groove on it, again, it's certainly worth using a sealant on those baby molars in the back, so you don't have to be concerned that things are happening. Baby teeth are a little softer than the adult teeth. They don't have as much enamel because they're not going to be there for a lifetime, so they're built a little differently. And so a cavity can still start there, and it can spread quite rapidly once it breaks through the enamel surface. So if there's grooves in that, the dentist or the hygienist can decide, and then they should be done. But if they're flat, then there's no reason to just routinely say, let's just put sealants in all these teeth. Okay. Now, the third part of your question was, and what about other permanent teeth? And again, we get into some other areas here. If the tooth has a deep groove in it, it's susceptible to cavities. But as a person gets older now, as I mentioned, the 6-year molar, that's the first tooth that could that has a groove in it other than those little teeth in the front that come in, your front incisors. But those are the first teeth that come in that have grooves in them and places where they can get cavities, by food staying in those grooves. The first one comes in at about age 6, and the last one comes in at about age 14. So somewhere between the ages of 6 and 14, again, if you have children, and you think about a child between 6 and 14, this is probably the years that they're mostly going to not be responsible because they haven't really grown and developed in that sense of responsibility. So, how well are they brushing their teeth, and how well are they taking care of their diet and what they're eating at school with their friends, and when they're not at home, when they're at the mall and they're, out in the street and everything. So if things are going to build up on those areas, then they're going to get cavities. And if they come in for cleanings and we see their teeth look like they're collecting a lot of stuff and they're starting to discolor and they're starting to weaken, then we would recommend sealants in more than just 1 or 2 teeth in their mouth. We might recommend it in all of those teeth as they grow in one after the other. So that would be an individual case by case basis.
Okay. So basically, a child gets a sealant on his back teeth if and when there is heavy grooves, usually for the second teeth, and they last him normally how long? A few years, a decade? What are we talking here?
I would feel comfortable that they should last at least, I would say a decade. I would say 10 to 12 years is not unusual. I've had many patients come in at about age 18 or so, and they still have their sealants and they haven't worn out through the years of chewing. If you get somebody who's going to be doing a lot of heavy chewing, those lozenges, instead of sucking on those lozenges, sugar-free, of course, as a dentist, but they decide they want to crunch down on them, if they spend years crunching down on, those mints, then they'll probably chip out those sealants before somebody who's more careful with what they're, putting in their mouths. Sticky candies, things like that.
So, from what I'm hearing, usually one set it does the job. At that point, the person doesn't really need them anymore.
Right. Once it's done on a tooth, that tooth is finished. Yeah, exactly.
Okay. Thanks a lot, Dr. Shannon.